Well, good morning, everybody. I'm Barbara Bentz. I'm a pediatrician. My board certified through the American Academy of Pediatrics, and also by training a behavioral pediatrician. I work for Sanford at this time. My current position and how I got involved with the zero suicide in North Dakota is through my position as president of the North Dakota chapter of the American Academy of Pediatrics. And I encourage everybody here, if you have children and you're working with a pediatrician, to certainly bring this information to them, because there are grants and so forth available to pediatricians and pediatricians in their offices. So I was really impressed with what Robin was talking about, because these are actually interventions that are going to make a difference overall with this issue, because they're grassroots. The whole idea of training and increasing the number of people who are trained to deal with this issue is what's going to bring this information out into the community. I work for Sanford, and certainly there are protocols available to identify children at risk and develop a triage system to get them to services. But if the services aren't available, or you're in a place where you don't have professionals that can work with your children, the ability to triage and ask the correct question maybe, at least from what I'm seeing from all of these numbers, is probably inadequate. There's a couple of things I want to go through today. The first one has to do with what is the kind of the developmental mindset of the child who might be at risk. And this is from the point of view of pediatrics. So what we know, the statistics that we know, we've gone over here, and I just very excellently presented by your other presenters here. The first thing to look at is developmentally in that age of kind of magical thinking. And I posted a picture here of Huckleberry Finn and Tom Sawyer. And the reason I did that is to kind of talk about the thinking that goes through at that developmental level. Because when we look at children as adults, we're thinking to ourselves, why are they doing that? And so unless you're in the mind of that child, it's difficult to understand. And I don't know, how many of you are acquainted with the Mark Twain story of Huckleberry Finn and Tom Sawyer? Well, you remember that one story where they go off on the adventure, and Huckleberry Finn is the example of somebody who can do absolutely anything in the world. He can just, nothing ever phases him. And Tom Sawyer is in a difficult situation. It's punitive. He has his Aunt Polly, who is very critical, and he looks at Huckleberry Finn, who seems to be able to do anything, and Tom gets reprimanded time and time again for all of those things. And he develops this sense of hopelessness, this sense of not belonging, certainly not belonging in the home that he's in. And he looks at Huckleberry Finn, and they go off on their adventure. And part of this adventure involves, as you're acquainted with, going down by the river and meeting some more people and getting involved in dangerous situations. And at one point, Tom decides he's going to go back home and just take a look at what's going on. He really wants to belong in that home. This adventuresome life is adventuresome, but where's the next meal coming from? It's dangerous. He goes back, and it's in the evening, and Mark Twain, typically all the negative stuff happens in the evening. So you'll see that if you read his stuff. He goes back, it's evening, and people are mourning his loss. And he's paying attention to that. They're mourning his loss because of all the mean things. Polly, I shouldn't have been so mean to him. I shouldn't have been so strict with him. And he looks and, oh, they're having a change of heart because I'm not here. And if I'm not here, they'll change their minds, everything will be better, and I can come back to this better place. That's the magical thinking of that age group. So there's an intolerable amount of psychological stress. He goes back to Polly. She's asleep. He sneaks into the house and gives her a kiss. He wants to be part of that family. And then he leaves. There's a big storm and a bunch of other things happen. But there's other examples in literature, and And I think if you see a child, it's really hard to know where they're at, who is the Aunt Polly in their life, what is really pushing them to that point where they think if they were dead, everything would change. And if everything changed, then he could go back. So the suicide is not a permanent solution in their minds. And so it's a different type of intervention when you're looking at that. The next set of people that we look at in terms of people who are not feeling as though they belong are the ones that are so well described by Robin, and that's that adolescent. When you see a young child, two little babies like this, you can't imagine what they're going to be like as adolescents. What are their risk factors? What's going to happen next? And then they are depending on you at this age. They're depending on those parents. Those parents for these children are 100% there all the time. And then they reach adolescence and they start to see those flaws, of which there are many. And they look somewhere else. Oh my gosh, these people that I depended on so strongly, they're not perfect. I'm going to find something else. In the case of Romeo and Juliet, Romeo gets a book. He starts reading it, and he feels love is the answer. Like so many of us who project onto the other what our solution is going to be in a time of extreme angst. And in this case, it ended out, his first love fell apart, and then he met Juliet, and then he realized what his true answer was. And once again became dependent on a situation that was volatile. And that's what happens in adolescence. They're seeking something else. It's so well described by all of the apps that are available. They're seeking something else. They find it as they're going through their own developmental issues, and their situation becomes intolerable because that person disappears. They've gotten rid of everybody else that could possibly help them. They're down to that one person, that one app, that one situation. It disappears, and there's no reason to live. So that's the developmental thing that impresses me as a physician. I can't see that, when they walk into the clinic. I can ask questions, but typically they're questions, even if they were to answer them with the parent present, which they won't, I may not have the resources available to help them. Now, as far as physicians go, I was impressed when I entered my first year of pediatric residency, when the director of the residency program asked me to go on to a ward where a pediatrician was having suicidal thoughts. And he told me that I was such a happy person that certainly if I was helping her out in that ward, she would quit having those thoughts. Because the only way she could get help would be to identify herself as suicidal or depressed. That would go on her record, and that would carry with her for the rest of her life. It may affect her ability to get a position as a job, get licensed. So I needed to go in there and help her with that situation. That represents what happens to physicians. Approximately, according to the conference I went to last fall, one whole medical class per year commits suicide. And those are the physicians, the ones that are caring for other people. Pediatricians are really low on that statistic, I must say. But that was my first experience with it, and I've had others since. The intervention is systemic. It's destigmatizing depression. It's destigmatizing suicidal ideation. It's what all of you are doing here, which is to reach out in the community, develop those I just think that's brilliant. Peer people who are capable of helping without having to go through a formal system, and getting help and then destigmatizing it statewide, nationwide, so that people will and can get help. So the book that kind of talks about adolescent suicide assessment and intervention, that's a classic, is Berman's book. I'm just leaving that for you. One of the big issues, one of the things that I do as the president of the American Academy of Pediatrics is to advocate, and unfortunately we're dealing with things that are setting children up for risks. CHIP is not reauthorized. All of these things, food security, environmental security, health security, are all at risk right now. And so that's some of the stuff that if you get involved or get involved with your pediatrician, please please encourage them to get involved, to get their voices heard both on the state and national level. So I'm just really impressed with all of you. I'm so glad, Allison and Cora, that I'm really glad to be part of it. Anything that I can do to help you along this way, please let me know.